We don't know for sure why life transitions, such as menopause, affect autistic people differently, but there could be multiple reasons. If we think of internal factors, it seems that neurodivergent people generally are quite sensitive to hormonal fluctuations. And some of the psychological characteristics of being autistic, such as struggling with uncertainty, could make these transitions especially hard because they are points where your equilibrium is kind of disrupted.
So far in our research, we found that autistic women are often very unprepared for the experience of menopause. They also don't necessarily recognise the symptoms that they're experiencing as menopause. And we found that many of the women had particularly difficult experiences in the past accessing healthcare and medical care. And so they're then in a situation where they find it difficult to access care for these symptoms that they were unprepared for and which they don't really recognise.
Some people found they sailed through menopause and they really didn't have any difficulties at all, so it's really important to recognise that. However, we also need to be sure that we're ready to support those who do struggle. Some of our participants reported a really severe decline in their mental health, their relationships, their ability to manage daily self-care, so people can really struggle.
We'd like to raise awareness of the experience of menopause, particularly for autistic women, so that people know more what to expect even before they go through menopause, so they can be more prepared.
We really need information out there that it is specific and geared towards autistic menopause. Our research showed that autistic people very often struggled to get help from their doctors at menopause. Sometimes their doctors really couldn't tell how much they were struggling because the signs of crisis can look different in autistic people. So it's really important that professionals working with autistic people are aware that this could be a time of difficulty, potentially of very severe mental health difficulties.